Well, a lot of concerns have come after health officials, of course, put that pause on the Johnson & Johnson vaccine. So what signs and symptoms should you be looking out for if you got it? And when could you possibly be in the clear?
Dr. Leo Lee is an infectious disease specialist with Beverly Hospital. He's joining us now to answer some of those questions. Dr. Lee, thanks, because this is really important. When it comes to the J&J vaccine, people want to know if they are safe. You know, at what point are you in the clear? How many weeks?
Okay. Actually, since we want to put on pause, what we do know at this point, it's a very rare reaction. Out of the 7 million doses that were administered, only 6 cases were reported, and all in women. All of them actually develop what we call a cerebral venous sinus thrombosis, which in layman's terms means that they develop a blood clot in the drainage system from the brain. They also develop what we call thrombocytopenia, which is actually low platelets. Now, they all develop their complications within 6 to 13 days after receiving the vaccination. So the FDA currently feels that if you're 3 weeks out, you should be fine, that your risks of developing this complication are extremely low. And given the fact that there are only 6 cases reported out of 7 million doses administered, it makes it very unlikely. Now, when we're talking about clots, when you develop clots, you can develop certain symptoms. And things to be on the lookout for would be, number 1, severe headache, any new neurological signs, problems with weakness, problems with speech. They did notice in 2 women that they also had clots developing in circulation to the abdominal organs. So sometimes abdominal pain and back pain may be a symptom. And then finally, if you develop pain in your legs or swelling and you have difficulty with breathing, that may be an indication that you've developed a clot in the leg that subsequently has migrated to your lungs or your chest. The other thing to keep in mind is because they also develop problems with low platelets. Now, platelets are normally involved in healing and in clotting of blood. And then there are actually 2 competing reactions, so that's why this complication is so unusual. But if you have low platelets, you're going to find that you're going to bleed more easily. With minor trauma, you're going to have big bruises. And sometimes you can develop what we call petechia, which are little pinpoint red spots on the skin, which indicate that you have bleeding underneath the skin. So for those individuals who receive the Johnson & Johnson vaccine, number 1, don't panic. All right. If you're 3 weeks or out from your vaccination, just be mindful and keep a close eye on it. Be vigilant. If you develop any of these symptoms, please contact your medical provider.
And talking with a lot of people who've been getting the vaccine, I think their concern is they're told about the possible side effects, like you could have pain in your arm or something, but then they're finding out headaches could last a week or beyond that. And so I think that is where the concern comes in what could cause this side effect with the blood clot, because this is all new. So is there anything else that you can give people at home in explaining, you know, other side effects potentially now coming up like a blood clot?
You know, there's actually nothing much out there because any vaccine is going to give you, for most people, they may give you some mild side effects, such as a sore arm, sometimes a headache. I've known a number of individuals who received the Johnson & Johnson vaccine, as well as the Moderna and Pfizer, who did actually have headaches and body aches afterwards. But those symptoms should be fairly mild, and in most cases, they should resolve in about 24 to 48 hours. Anything which goes beyond it or seems excessive or extreme, we always recommend that you just talk to your doctor just to make sure that it's nothing more serious. We just need a lot of reassurance out there. The other thing I also want to stress is the current 2 vaccines, the Pfizer and Moderna, have not had any reported complications in terms of clots. So they are a different technology. They use mRNA as opposed to the Johnson & Johnson, which is a DNA virus. So I would encourage people to continue getting those vaccinations. They're available now. As of yesterday, they are available to anyone 16 and older. So please get your vaccinations.
Okay, Dr. Leo Lee, we really appreciate you joining us this morning. Thanks for everything. Have a good day.
Thanks, Doctor.